Hello, my name is Dr. Ron El-Harwary. I'm from Halifax, Nova Scotia, Canada, and today I'll be speaking to you about a condition called spondylolisthesis. Isthmic spondylolisthesis refers to a slippage of one vertebrae with respect to another. It is related to a microfracture or a gap between the upper and the lower joints of two vertebrae. If this microfracture does not heal, the gap can widen and one vertebrae can slip forward with respect to another. This most commonly happens at the lowest area of the lumbar spine, the fifth lumbar vertebrae, and the upper aspect of the sacrum or tailbone. The main symptom of spondylolisthesis is that of persistent pain related to nerve root stretch or irritation. This pain is generally located in the lower back but can radiate towards the buttocks and the lower legs. The nerve root irritation can also cause symptoms such as numbness or tingling down the legs. It can also cause stiffness or hamstring tightness. If the hamstring becomes tight in relation to the stretch on the nerve root, the body responds by going into a crouched posture. By flexing the hips and the knees, that can relieve the tension on the nerve root and potentially improve the symptoms. The severity of spondylolisthesis is graded based on how far the vertebrae is slipped with respect to the one below it. The grading system goes from 0 to 5. A grade 0 means that there's no slippage at all, that there is simply a microfracture or a gap. If the vertebrae slips forward with respect to the one below it, it is then graded from 1 to 4. This is based on how far it is slipped. If it is slipped less than a quarter of the way, it's a grade 1. Between a quarter and a halfway, it's a grade 2. Between halfway and 3/4, it's a grade 3. Between 3/4 and 100%, it's a grade 4. In its worst case, a grade 5, the vertebrae has slipped all the way off of the one below it. That's called a spondyloptosis. No, not all spondylolisthesis requires surgery. If it is slipped less than 50% of the way with respect to the one below it, such as a grade 0, 1, or 2, often the symptoms can be treated non-operatively. Modalities such as anti-inflammatories, physiotherapy, and bracing may help relieve the symptoms. If the spondylolisthesis progresses beyond 50% of the way, such as a grade 3, a grade 4, or a grade 5, surgery is often warranted. Surgery involves fusion from the fifth lumbar vertebrae to the first sacral vertebrae, potentially includes the fourth lumbar vertebrae as well. The fusion happens by placing some screws into these vertebrae, and the spondylolisthesis is stabilized with some rods. Bone graft is placed to fuse those segments together to try to prevent further slippage. As part of the surgery, some of the loose parts of the bone are removed in order to relieve some of the stress or tension on the nerve roots. In some cases, the lower aspect of the spine is realigned, and in other cases, it is simply stabilized in the position that it is slipped in.